We will start in 2 minutes. Hey, great. Let me know when it's 10. Okay. Okay, 1 more minute. Okay, it's 10. Everybody's with me? Yes. Please know that we are more than willing to help our Montana and Harlem students. I will hold a separate session for them for MSK2 lecture content so that we have enough room for learning for everybody. Okay. So let's see what is my plan today. Weekly recaps are more important than just exam recaps. That's why I do weekly recaps every week so that you are done with those lectures and you perform better. So you're not opening these lectures for the first time before the exam day. Please see, we learned fibrous protein, glycoprotein, and proteoglycan this week. This is not an exam review. Exam review will be next Friday for the exam where I'll bring everything. This is your weekly review. So my plan is first I will recap fibrous protein, glycoprotein, proteoglycan. Then I will open Dr. Panini's lecture because many students are finding trouble going through the sections. So I will make it simplified and tell you what is your focus. Right? Please keep yourself mute so you are not heard when I'm talking, right? If you have questions, I will also open question for room for question. But if anything that you can quickly ask, yes, feel free to ask. So everybody is ready? How are you feeling though with MSK2? Great. I think MSK2 is a very good grade grabbing exam because it's a combination of biochemistry and genetics. Genetics is also not that tough that you need tables, you need to go on find out the genetic code, not extensive calculations. Does that make sense? So please make sure you grab these 16 questions. So there will be 16 questions on the exam. There are 4 lectures. Each lecture will be equally tested. So let's see what we learned in fibrous protein. I might not be able to see your chat. Let me finish the recaps. Then I'll take a look at your chats. Is that okay? Because I need to keep going back and forth. First of all, we learned that there are fibrous protein. There are 2 types of protein, fibrous and globular. Globular protein will come in CP module. This module, MSK2, we are doing fibrous protein. You can hear me well, and are you seeing my slides, everyone? Yes?
Yes, we
Yes?
are.
Great. Fibrous protein are more long than broad, and that's why they have more structural than dynamic role. Which are the fibrous protein Dr. Kamath has introduced in his video lectures? Collagen versus elastin. Should you understand the difference and different clinical conditions with that? Yes. Before that, let's bake the cake, right? Clinical conditions, icings will come later. So let's see what is collagen. It's a triple helical structure, 3 chains wound around each other. Every third residue is glycine. Why? Simplest, smallest, can fit in and responsible of stability of collagen. Application, this is called baking the cake. What is icing? The most common mutation is glycine replaced by a bulkier amino acid. Who will tell me which collagen disease have you learned this more common mutation is more commonly associated with replacement of glycine with a bulkier amino acid? Osteogenesis imperfecta, one or two? Two, right? So you're specific. So you have to know normal to know abnormal. Most avidly consumed, very important for your boards too, most avidly consumed during collagen or fibroblast processing. Also, then what are the other amino acids apart from glycine? Proline and lysine. Do they undergo any kind of modification? Anyone wants to answer that? The glycine is the most common. Hydroxylation, proline and lysine undergo hydroxylation. Do they undergo anything else too? Who undergoes glycosylation? Who undergoes glycosylation? Hydroxylysine, right? We will know that, then I will tell you the difference. So this is what we learned for collagen. Triple helical structure. Every third residue glycine, most abundant, simply fits, gives stability. Glycine replaced by bulkier amino acid, collagen disorder. Which one specifically? Osteogenesis imperfecta. Which one again? Type 2. Why not type 1? We'll get to that later. Triple helical structure. Also, please. Again, you need to know normal to know abnormal. When you say three chains wind around each other, there are two types, alpha 1, alpha 2. Look at this. Which is more, alpha 1 or alpha 2? Which is more, alpha 1 or alpha 2? You must have seen the col A1 gene, A2 gene that is related to alpha 1, alpha 2. Alpha 1. For that, you should also know how many types of collagen you have. 1, 2, and 3. 1 skin, 2 cartilage, 3 blood vessels mainly. Although they are distributed like that, 1 skin, 2 cartilage, 3 blood vessels, still their clinical condition is not related to it. For example, tell me what is the collagen 3 disorder? Tell me the collagen 3 disorder. Any collagen 3 disorder you have learned? EDS. Now, where is collagen 3? Blood vessels. But what is the presentation of EDS? Does it involve blood vessels? What is the presentation of EDS? Blue eyes is osteogenesis imperfecta, please. Stretchy skin and hypermobile joint is EDS. Blue eyes is osteogenesis imperfecta. So you got to be careful there. Blue sclera, it's not, eyes, blue sclera is not EDS. So imagine 1 skin, 2 cartilage, 3 blood vessels. Still clinical presentation of collagen 3. EDS is stretchy skin and hypermobile joints. So it's not that their distribution is related clinically. Clinical signs and symptoms may be different. Please pay attention on that. Does that make sense? But alpha 1 chains are more. That's why mutation to alpha 1 chain may cause more disruption rather than alpha 2 chains. Where is this quantitative reduction in the alpha chains? Which collagen disorder have you learned that the alpha chain synthesis is reduced? Which disorder have you learned? Yes, it is. Sorry, I have to go back to your chat, so it takes some time. Yes, osteogenesis imperfecta, and also you have to be specific, type 1. So are you seeing how the normal baking of the cake is connected to icing the cake, whether it's EDS, osteogenesis imperfecta, alpha 1 antitrypsin deficiency, or Marfan syndrome? So are you aware of type of collagen which is predominant is please type 1? And there are 3 types which are usually talked about, 1, 2, and 3. 1 skin, 2 cartilage, 3 blood vessels. Now, is this important? Yeah, this is also baking the cake. What you start with, hydrophobic sequence and terminal. Hydrophobic sequence, always N is on the left of the peptide, C is on the right. Hydrophobic N is saying this protein needs to be exported out. First step. Second step, hydroxylation. Hydroxylation is of which residues? Anyone? Hydroxylation is of which residues? Hydroxylation is of proline and lysine. What nutrient is required there? What nutrient is required there? Which is the second step. Vitamin C. So if there is no vitamin C deficiency, scurvy, vitamin C is also known as ascorbic acid, there will be no hydroxylation. Are you seeing my, let me bring my pointer so that it's just a second. Right. So you see hydroxylation of proline and lysine residues, vitamin C. If there is no vitamin C is also known as ascorbic acid, vitamin C deficiency, no hydroxylation, no hydrogen bonding, weak collagen. Capillaries give way to this weak collagen. And what is the presentation then? If the collagen is weak, so collagen fibers are, yes, I will tell you that later. Not collagen fibers. Somebody is asking me. The triple helical structure starts from C terminal, but N hydrophobic sequence, which is the first step, on the top is N terminal. So I will tell you what is going on in C terminal. Very good. Yes, somebody answered really well. Vitamin C deficiency, bleeding gums, or falling out of teeth. Then what happens? Glycosylation of only hydroxylysine residues. Just to let you know, there are no hydroxylysine in elastin. So what do elastin miss? Which process elastin will miss? There are only few differences between collagen and elastin. You can go back to glycosylation. You can go back to Dr. Kamat's slide. I am doing a quick recap so I can address every little detail, but I want to address the major details. Absolutely, because elastin has no hydroxylysine. What process is missing in them? Glycosylation. Please, I will not rush through this section. I'll ask your question, be a little more interactive, and I hope you follow my piece, right? So yes, the third step is glycosylation of hydroxylysine residues. Now somebody asked me, what is triple helical formation? Omega, orange juice, vitamin C. Yeah, sure, great. Anyway, you can learn. So now what's the fourth step? First was hydrophobic end sequence. Second was hydroxylation. Third was glycosylation. Fourth step is triple helical formation. This starts at the C terminal. C is on the right, N is on the left. This starts on the C terminal by what? What are you doing to form the triple helical structure? Because you know collagen is arranged in the form of three chains wound around each other. Terminal disulfide bonds, which are known as terminal disulfide peptides. Now, what is this structure known as? Anyone? What is this structure known as? With the terminal disulfide, it's known as procollagen. You got to understand these terms, especially for boards. Please see that we have only 16 questions. Not every concept can be tested, but these concepts are important for your boards. So up to procollagen formation, everything is intracellular. Where is it happening? Where is this intracellular? Where are all these intracellular processes happening? Rough endoplasmic reticulum. Now, this is secretion of procollagen. First, hydrophobic end sequence. Second, hydroxylation. Third, glycosylation. Fourth, triple helical formation by disulfide. Fifth, secretion of collagen. Sixth, who will tell me sixth? Sixth is formation of what comes next when procollagen is secreted out? Tropocollagen. So that is an extracellular step. This is a hard line where extracellular step starts. Yes, tropocollagen. How do you form tropocollagen? Cleavage of terminal disulfide peptide. Now, now there is assembly of collagen fibrils and maturation of collagen fibril into mature collagen fiber. So after tropocollagen formation, there is assembly of collagen fibril. Then there is maturation. Maturation is to form a mature collagen fiber. Tell me what all you need to form a mature collagen fiber, which is important for collagen to be strong. apart from hydroxylation? Lysyl oxidase, and what does it require? Lies copper. Absolutely. Once you form this mature collagen fiber by lysyl oxidase and copper, the mature collagen fiber assemble and that finishes or aggregates that finishes collagen processing. First difference, though there are many differences between collagen and elastin, I'm pointing out the ones that I see here. Please go back to Dr. Kamat's slide and refer to the points. One difference in elastin is elastin do not have hydroxylysine residues. So there is no glycosylation. Second difference is in the lysyl oxidase in collagen helps in forming aldol crosslinks. What are these crosslinks? These crosslinks are links between modified lysine residues. But this is replaced by these aldol crosslink by the same enzyme, lysyl oxidase. Same nutrient copper is replaced in elastin by anyone. What is there in elastin instead of aldol crosslink in collagen? What is desmosin? Very correct. What is desmosin responsible for? The stretchy property of elastin to stretch and come back to its shape. So we bake the cake, right? Let's get to the icing. Dr. Kamath has explained them on different slides. I have brought them together in one single slide. I like giving overview and making things simplified. He talked about vitamin C, hydroxylation, vitamin C, ascorbic acid, scurvy, which is the where do you have a hard line where the extracellular events start, that is outside RER, is secretion of procollagen and formation of tropocollagen. So you know the steps, the slides will be shared with you. I told you there are 3 chains. Alpha 1 is double alpha 2. Also, please understand, since alpha 1 is more than alpha 2, alpha 1 mutation will be more, will affect more collagen disease than alpha 2. Similarly, N and C, somebody was asking me. N-terminal hydrophobic is on N-terminal, but terminal disulfide peptide is C-terminal. So if C-terminal mutations are there, then you will not form what? For example, if there is a C-terminal mutation, what process will be affected mainly? If there is a mutation at the C-terminal, what will not be formed? What is directly involved at C-terminal? Procollagen, disulfide peptide, right? And what will affect the N-terminal? What if there is a mutation towards the N-terminal? What it would be mainly affecting? Which step? Which is the first step? Remember, N-terminal? What do you add? N-terminal, first step. Anyone? Yes, the signal sequence, the hydrophobic signal sequence, absolutely very good, which is cleaved. Once the ribosome synthesizes this N-terminal hydrophobic sequence and the protein moves in the RER with the sequence, then sequence is cleaved because the purpose of ribosome synthesizing with a protein with a signal sequence on N-terminal is accomplished. That means this protein will be exported out. We did that. See, you're linking. You did that in post-translation modification. For protein to be moved out, you would have to have signal sequence on N-terminal, move it into ER, Golgi, and export it out. Right? Do you remember that? So you are doing compartmentalization. You're not just throwing it in the air, right? You're baking the cake in the oven, right? So you should know where the processes are happening. Similarly, forming mature collagen fiber, copper, lysyl oxidase, aldol crosslinks are replaced by desmosin in elastin. Did you do Menkes kinky hair disease? So no, I'm not saying that N-terminal will not prevent cleaving, but remember, when you say N-terminal, the first step is addition of hydrophobic sequence. I'm just saying it will start right from the top. But Terminal disulfide peptide starts from the C terminal and go towards the N terminal. So they will not be much affected in N terminal mutation. But then, as Aaron is asking, definitely, first, when you will not even add the N terminal hydrophobic sequence, the collagen processing is already stopped, right, Aaron? So I was bringing your attention right to the top. But that doesn't mean if the first step is not happening, anyways, it will not go on. Did I answer your question? That's a good one. Yes? Right. And definitely later on, there is cleavage of both C and N terminal peptide. When you cleave both C and N terminal peptide, what do you form? What do you form and where? When you cleave both C and N terminal peptide, what do you form and where? Cleavage of tropocollagen, where do you form it? Extracellular. So it's not that N-terminal mutation will not affect that step, but the first step will be affected and everything will halt, right? Menkes kinky hair disease is a copper defect. Where have we learned? So in other words, collagen fiber formation is prevented, there is mutation in. Could be if there is an N terminus mutation, but all I'm trying to bring your attention to is which specific step will be affected, Amir. Definitely, N terminus mutation may affect, but specifically which step? That is where I'm bringing your attention. Hydrophobic sequence or sequence signal is N terminal, disulfide peptide is C terminal. Absolutely. Did I answer your question? Great, yes. Let's go further. I have opportunity or chance to give you more to ask question. Let's finish this first. We did Menkes kinky hair disease, which is copper defect. I always bring in copper versus Wilson. I like differential. Do you do differential of the common finding, common presentation in Menkes and Wilson? Wilson is coming later, is copper defect. But why are you relating copper to collagen processing? Why are we relating copper to collagen processing? Because of lysyl oxidase. Is that event extracellular? Is this event lysyl copper oxidase extracellular? Yes, absolutely right. And this is replaced by desmosin and elastin. Then we did osteogenesis imperfecta and EDS. Tell me, which is a brittle bone disease, trivial fracture, fracture after a trivial fall, blue sclera? Which one is that? Osteogenesis imperfecta. How many types? One and two. Which is quantitative, one or two? Which is quantitative, one or two? Quantitative is one, reduce alpha chains. What is two? Glycine replaced by a bulkier amino acid. That is two. And what type of collagen is affected here? One or three? One or three? One. Imagine collagen 1 was in skin, but the signs and symptoms here are brittle bone disease. So the normal localization of one skin, two sclera, and two cartilage and three blood vessels is not related clinically, but that's okay. You got to differentiate. What is EDS? What is EDS? Signs and symptoms. EDS is the stretchy skin and hypermobile joints. You can do that, right? Stretchy skin and hypermobile joints, type 3. What is the most common mutation here? Collagen processing enzyme defect. When they say collagen processing enzyme defect, see, look at here, keep memorizing bring back your collagen processing enzyme defect. When we give you a focus, as much as you beat around the focus, you get an A grade. So when you see EDS as a collagen processing defect, revise your collagen processing. Give me one or two enzymes for collagen processing defect. Just one or two. Since EDS is a defect in collagen processing, what enzymes come to your mind when it's collagen processing? Hydroxylase, glycosylase, peptidase, lysyl oxidase. Do you understand? Peptidase that cleave the terminal disulfide peptide. We have done questions too. I'll bring some. Oh, sorry. What happened? Where did I go? Okay, we did questions too, but I will bring questions. This is in our this will exam review will be next Friday, right? So do you talk about lysyl oxidase, copper, aldol crosslink? They are replaced by desmosin in elastin, which gives stretchy property to elastin. Please, Marfan syndrome, do not confuse with EDS. They have a disproportionately long arms, slender fingers, thin build. What else? Tell me. You will see in Marfan syndrome. Any other finding you want to add? Apart from disproportionately long arms, slender fingers, you dislocation of lens, which is upward, and involvement of very good large aorta rather than small and medium sized vessels, which is that's why they have aortic regurgitation, aortic dilatation. You see here, they involve large aorta. So that is Marfan syndrome. Now, collagen is degraded by collagenase. Elastin is degraded by elastase. Who checks elastase in your body? Who checks elastase in your body? Alpha 1 antitrypsin deficiency. Now, if alpha 1 antitrypsin is missing, elastase will keep going on and on and on. Where is your elastin? Where it will be degraded? Where is your elastin? Elastin is in the alveoli of the lungs. That leads to emphysema. Smoking worsens it. Why? Because especially alpha 1 antitrypsin deficient individual, because they're already low in alpha 1 antitrypsin. Smoking modifies this enzyme and further reduces the availability of this enzyme. So smoking is not good. Anyways, it's not good, but not good for alpha 1 antitrypsin deficient patients. Let's do glycoprotein proteoglycan. Please see, I'll give you a chance to ask questions. Let's do the quick recap. I will also open Dr. Panini's question lecture in the end because students are stressing with it, right? I don't want you to stress. I want you to shine out, right? Does that make sense? So let's see how we can make it easy. What is glycoprotein and proteoglycan? First of all, you want to understand they are glycoconjugates. What do you mean by glycoconjugates? Carbohydrate is associated with a non-carbohydrate moiety. What's the non-carbohydrate compound here? Anyone? When we say glycoprotein, proteoglycan, protein. There is a learning objective. Stick to your learning objective where they've asked you to compare and contrast proteoglycan with glycoprotein. Although it's called proteoglycan, still carb is more than protein. Tell me what's the GAG or what's the sugar in proteoglycan? What's the sugar in proteoglycan? What's the sugar in a proteoglycan? GAGs. Are GAGs always negatively charged? Absolutely. What's the sugar in glycoprotein? What's the sugar in glycoprotein? Oligosaccharide. Oligosaccharide may be negatively charged, not always negatively charged. And who has a cell surface function rather than extracellular matrix or support function? Who has a cell surface function? Somebody saying GAG. GAG is not a correct answer. Cell surface function is glycoprotein. Glycoprotein, glycolipid have cell surface function, whether it's recognizing bacteria, cell, blood group antigen, anything. So you got to pay attention on compare and contrast glycoprotein versus proteoglycan. If you want to understand their synthesis, please don't break your head. Google synthesis, know the structure, you will know synthesis. For example, proteoglycan, do they have an O linkage or an N linkage? Proteoglycan, do they have an O linkage or an N linkage? They have an O linkage. So their protein should be rich in asparagine or serine threonine. Serine threonine, there is no N linkage in proteoglycan. They have this trisaccharide code which you don't need to memorize. It just helps you understand that you're talking about proteoglycan. Then, what are the sugars in proteoglycan? Anyone? What are the sugars in proteoglycan? Sugars in proteoglycan are? What are the sugars in proteoglycan? What are they called? Anyone? No, sugars. What are they called? What I'm not asking what are they made up of. Or what is their structure? Gags. Very good. Gags is not for laugh here, right? That is why what comes next is gags. Gags are repeating unit of acidic and amino sugars. Please know amino has positive charge, but gags are negatively charged. That's why amino sugars are their positive charge is negated by what groups? What groups are on gags that neutralize the positive charge of the amino sugars? What groups? Sulfated and acetylated. So don't stress out, understand the concept. Believe me, you will get good grades in biochem if you understand the concepts. If you keep drawing this structure, no need to do that. Recognize them, understand them. Secondly, they are highly negatively charged. Is it responsible for function of gags? So please keep gags. So what is gags? The last unit of repeating unit of acidic and amino sugar. This is gag. The whole portion is not gag. So what is the whole portion? What is the whole structure known as? Is it known as gags? The whole structure is known as combining proteoglycan. So keep them separate. The whole structure is proteoglycan. Only the last portion of acidic and amino sugar repeat is gags. Secondly, don't stress out with the buzzwords uronic acid, glucuronic acid, iduronic acid. They are nothing but the acidic sugar. Don't get stressed out by N-acetyl glucosamine, N-acetyl galactosamine. They are just acetylated amino sugar. But the thing is, when I'm saying glucuronic acid, iduronic acid, am I talking about glycoproteins? I just want you to distinguish, compare, and contrast. When I'm saying glucuronic and iduronic acid, no, I'm not talking about glycoprotein. I'm talking about proteoglycan. Then we will learn what are the gags in your body. Don't forget that older terminology for gags is older terminology for gags. Mucopolysaccharide. That is why till date, defect in degrading gags within the lysosomes is known as mucopolysaccharidosis. Where does degradation of gag happen? Anyone? Where do you degrade gags? In the lysosomes. Is mucopolysaccharidosis a lysosomal storage disease? Is mucopolysaccharidosis a lysosomal storage disease? Absolutely. Abs- no, who says no? Is mucopolysaccharidosis a lysosomal storage disease? Yes, it is, right? How are GAGs, proteoglycans synthesized in the same order? What is added last is removed first when degrading. Who will be degraded? Who will be removed first? Sulfate. Then everything will be degraded. Finish. This is synthesis and degradation. Synthesized in the same order, degraded in the same order. That means the intermediate or group which is added last is removed first during degradation. Right? Is glycoprotein same as proteoglycan? No, they are O versus N linkage. So what is the difference? Also, what is the other difference? One difference is glycoprotein can be O as well as N linkage. What else is the difference? Proteoglycan is always O linkage, but glycoprotein can be O as well as N linkage. What else is the difference from proteoglycans? Proteoglycans are always O linkage, but glycoprotein can be O and N. What else is the major difference between glycoprotein and proteoglycan? You can say sugar is short and branched in glycoprotein and linear and unbranched in proteoglycan, but I'm not looking for that. Very important difference. Very important difference. Sugar in proteoglycan is GAGs. Sugar in glycoprotein is oligosaccharide. Absolutely. Then you talk about mannose, sialic acid. That's later, please. What's the major other difference? Do you see in yellow? The sugar in glycoprotein instead of GAGs is what? Instead of GAGs is, that's a major difference. Apart from proteoglycan only O linkage, glycoprotein can be O and N, but the other major difference is instead of GAGs, glycoprotein have oligosaccharide. Yes, you are not incorrect that sugars in glycoprotein are short and branched. Sugar in proteoglycan are linear and unbranched. Yes, mannose are seen in glycoprotein. Mannose residues are not seen in proteoglycan. Similarly, glucuronic acid, iduronic acid is seen in glycoprotein or proteoglycan. Glucuronic acid, iduronic acid, proteoglycan. So there are some buzzwords that compare and contrast these glycoprotein proteoglycan. Keep an eye on them. Is there a pentasaccharide core? When you see a pentasaccharide core, it is also rich in mannose, which is seen in N-linked glycoprotein. Why I'm pointing this? Dr. Panini has explained extensively actually N-linked glycoprotein synthesis, but I will simplify it. Did he mention a pentasaccharide core there in N-linked glycoprotein synthesis? Yes or no? Yes, have you watched his lecture? Yes. So that is why you got to know the differences. Secondly, example, because Dr. Panini has also tested you on example. What are all-link glycoprotein example? Mucin, collagen, intranuclear protein. Now, which one of them have sialic acid? Please, I'm not doing this recap just from exam point of view. I'm also doing this recap because you have a video to watch and you have some concerns with Dr. Panini's video. I want to simplify it, right? So when I'm saying O-link glycoprotein is collagen, mucin, intranuclear protein, which one of them have sialic as oligosaccharide chain? Mucin. Very correct. Has Dr. Panini tested you on mucin? He has given you, I'll go to that slide when I open his lecture PowerPoint. So yeah, it's good to know it has sialic acid because otherwise you can answer Dr. Panini's question on the lecture slide. But what are examples of N-linked glycoprotein? High mannose, complex and hybrid. Now, which one has sialic acid? High mannose, complex or hybrid? Which one has sialic acid and aniline glycoprotein? High mannose, complex or hybrid complex? Does that make sense? Now don't flip-flop, don't mix to understand and answer Dr. Panini's question and compare and contrast glycoprotein. But I want you to please note, it's important that high mannose type are lysosomal enzyme because we will be doing eye cell disease. So where is eye cell disease? O-linked or N-linked glycoprotein problem? Where does eye cell disease come? O or N-linked glycoprotein problem? N-linked, right? That's why I want to bring your attention. Now, please see this. Also, students are confused. Pentasaccharide core is seen in mannose. But if you want to form lysosomal enzyme, you will add more mannose. Whatever chains you add, you will form different N-linked glycoprotein. For example, if you add sialic acid to the pentasaccharide core, what will you form? For example, if you just add sialic acid to pentasaccharide core on the right side, which N-linked glycoprotein will you form? Complex. That's all you need to do. You don't need to get into details, get lost in details, though Dr. Panini has very well explained the lecture slides. Again, glycoprotein versus proteoglycan. This is glycoprotein, this is proteoglycan. The sugar is short and brand, cell surface function. Here, sugar is linear and unbranched. Please know this is a GAG, which is hyaluronic acid. This is proteoglycan monomer. In the center, what is the center? What was the first? Remember? What is the first thing? In proteoglycan, what do you need? A protein rich in? No, so hybrid have both sialic and mannose. Hybrid have both sialic and mannose. I asked you, what if you want to add just sialic acid to the pentasaccharide core? Then you will form complex, right? Hybrid has both sialic acid and mannose. Very good. This is core protein rich in serine and threonine. Then this is sequentially added. You will see xylose, galactose, galactose, which you don't need to know. And then repeating unit of acidic and amino sugar. So that is bottle brush, you clean the bottles of babies. That's the proteoglycan. So I'm comparing and contrasting. Proteoglycans have what sugar now? What sugar do proteoglycans have? What sugar do proteoglycans have? GAGs. Now, GAGs are negatively charged, so they slip pass over each other, responsible for mucus secretion function. They absorb water, so they are shock absorbent. They are part of extracellular matrix. That's why I introduced in the beginning that proteoglycan have ECM function and glycoprotein have a cell surface function. So let's recognize some of the GAGs and know their function physiologically and clinically. They are shock absorbent. Can you give me the name of, can you name some of the GAGs? Can you name some of the GAGs, please? Some of the GAGs, you want to name them? Hyaluronic acid, heparin sulfate, heparin, dermatan, keratin, know where they are. Hyaluronic acid is a shock absorbent. So have you done all these GAGs? Sorry, chondroitin, chondroitin, cartilage, keratin, cornea, dermatan, skin. Also, you should know there are some gags less negatively charged. That's why they don't fan out too much in the proteoglycan structure. Which gags are less negatively charged? Keratin sulfate and hyaluronic acid. Which gags have hyaluronic acid? Which GAGs have hyaluronic acid? So keratin sulfate and hyaluronic acids are less negatively charged. That's which GAGs have hyaluronic acid? Heparin and dermatan sulfate. Yes, that is why they accumulate in which disorder? Heparin and dermatan sulfate in lysosomes accumulate in which disorder? Hurlers and hunters. Because hurlers is hyaluronidase, hunter is hyaluronate sulfatase. That means they will not be able to degrade GAGs that have hyaluronic acid. So which GAGs have hyaluronic acid? Which GAGs have hyaluronic acid? Yes, which GAGs have hyaluronic acid? Heparin sulfate and dermatan sulfate. So please first bake the cake. Bring your proteoglycan. Bring the sugar in them. Know their example. Put them in the right place. Know their role physiologically and clinically. Then you are going to jump to Hurler's disease, which is icing on the cake, though it's not icing. Not just dermatan, also heparin sulfate has hyaluronic acid. Both heparin and dermatan sulfate have hyaluronic acid. Then you go to the icing, which is Hurler's Hunter eye cell disease. But first, bake the cake. Okay? Are we baking the cake right? Yes? Everybody's good? Are you following my pace? All good? Great. Let's go further, right? So this is the bottle brush. Bottle brush is proteoglycan. This is the protein, green, rich in serine threonine. And you have the same sequence, xylose, galactose, galactose. Then, sorry, let me get my point. Laser pointer here. Yes. Xylose, galactose, galactose, acetic and amino sugar. The same way they are degraded, where? Lysosomes. Monomers, look at this keratin sulfate. Remember, keratin and hyaluronic acid are less negatively charged, so see, they don't fan out. But others who are highly negatively charged, they fan out a lot because they're highly negatively charged. They don't fan out. They are right at the bottom. That's why they don't fan out because they are less negatively charged. Gags are always negatively charged. Bottle brush appearance. Please, I am bringing different slides to make your learning easy. You can go back to the complex slides and still learn them better, right? Does that make sense? Again, this is the hyaluronic acid. This is monomer, aggregates of proteoglycans, bottle brush appearance, and same thing. So are you understanding where I will talk about gags, where I will talk about O linkage, N linkage, mannose, sialic acid. I will also tell you other terms, glucuronic acid, hydronic acid. This is also one of the function of heparin. Heparin is attached to your blood vessel wall and it also helps in hanging lipoprotein lipase, which is an extracellular enzyme and will come in CP module. What I'm trying to bring your attention to is these gags have a normal function in your body. physiological and clinical. First, do them from lecture slides, then you come to hurlers and hunters. Does that make sense? I'm bringing your attention, your focus. What are the right ingredients to bake a good grade cake, right? You want a good grade cake, yes? And I sit with an A. So let's do that. Where are gags degraded? You know where are gags degraded? Where are gags degraded? Where are gags degraded? Within the lysosomes. Are gags also known as mucopolysaccharide? Older terminology. If you can degrade them within the lysosome, do you have lysosomal storage disease? Which are the ones we will be learning this MSK2, her mucopolysaccharidosis, though Dr. Panini has also talked about Sanfilippo and other mucopolysaccharidosis. They only differ from each other from the type of gags positive in urine and also eye cell disease. So let's do hurlers and hunters. Who has a good eye and hunts for an X? Who has a good eye? Hunters have a good eye and they are X-linked. So hunters have no corneal clouding and they are X-linked disorders. And also the enzyme missing in them is iduronate sulfatase. But they are single enzyme deficiency disorders, so you don't see inclusion bodies. Inclusion bodies, eye cell disease, where you see more debris, because eye cell disease is not a single enzyme deficiency disorder. Number of lysosomal enzymes are missing in it because it's a lysosomal targeting defect. But mucopolysaccharidosis is a single enzyme deficiency disorder, so you will see a particular substrate accumulating like heparin and dermatan sulfate. So does heparin sulfate and dermatan sulfate differentiate? Accumulation differentiates hurlers from hunter? Does accumulation of heparin and dermatan sulfate differentiate hurlers from hunter? No, because in both of them they accumulate. The difference is hunters is X-linked and there is no corneal clouding. There is a successful enzyme replacement therapy with hurlers. So tell me, what would be the enzyme replacement therapy for hurlers? Give me the enzyme. Give me the enzyme which will be a successful enzyme replacement therapy for hurlers. What should be? Iduronidase. Iduronidase, absolutely. Let's go further. So we are talking about now mucopolysaccharidosis. Please, these features, coarse facial features, they can be seen in hurlers, hunters, eye cell disease because they are lysosomal storage disease presentation, especially with the enzymes involved in it. So don't get carried out. But see, you see corneal clouding here. You see corneal clouding and coarse facial features and accumulation of heparin dermatan sulfate. What are you thinking? Corneal clouding, coarse facial features, accumulation of heparin and dermatan sulfate. What is your diagnosis? Hurler syndrome. So you should be familiar with clinical finding in MSK2. Absolutely. Hunters are X-linked. They have no corneal clouding. Hunters have a good eye. They hunt for an X. Blood group. Now, blood group should be glycoprotein or proteoglycans. Blood groups. Blood groups should be glycoprotein or proteoglycan. Glycoprotein and also glycolipid actually. So blood groups are example of glycoprotein. Then they have all, Dr. Panini has also explained compatibility. You don't need to memorize all that. All you need to know, how do you get blood groups? If you have this sugar, A. If you have this sugar, B. If you have both, AB. If you have none, O. But your blood group depends on these glycoproteins, or they are also glycolipid. Dr. Panini has explained O and N-linked glycoprotein synthesis. I've brought this slide so because students are also confused with this process. All you need to know, first of all, am I talking O or N-linked? Am I talking O or N-linked? Here, I'm talking N-linked glycoprotein. Please see, N-linked glycoprotein will be synthesized by the ribosome. Naturally, the protein here will be rich in, because it's N-linked glycoprotein. Protein here would be rich in Protein will here would be rich in asparagine. Once the proteins are glycoproteins are synthesized and linked, they have three fate. Either they go to the lysosomes, they are exported out, or they are part of the membrane. They only have three fates, aniline glycoprotein. Part of lysosome, exported out, or part of the membrane. Let's see how that happens. Again, aniline glycoprotein, do they need protein rich in asparagine? Yes. Aniline glycoprotein, the oligosaccharide element also contain mannose. Yes, aniline glycoprotein also contain mannose. Absolutely, high mannose aniline glycoprotein are known as lysosomal enzymes. Yes, they also contain it. Right, correct. Now look at this. You know the structure, you know the synthesis. You don't need to get lost in Dr. Panini's slide. This is, I will see to your questions in the chat. I think I just want to finish this. Okay, I will answer your question because I want to really go through Dr. Panini's slides quickly in 5 minutes. Okay. So remember the structure. You need asparagine. What comes next in aniline glycoprotein? What do you want to add after asparagine? After asparagine, ribosomes have synthesized asparagine. What do you want to synthesize next in aniline glycoprotein? What should come next, anyone? What should come next? Pentasaccharide core. But look at this. In aniline glycoprotein, who is carrying the pentasaccharide core? A lipid carrier known as dolicol. Do you see the same dolicol in aniline glycoprotein? I will also compare and contrast their synthesis. In aniline glycoprotein, has Dr. Panini mentioned dolicol? No. Dolicol is for aniline glycoprotein. It carries the pentasaccharide core and look where it attaches right after the asparagine, aniline glycoprotein. Pentasaccharide core. Now, there are three types: high mannose, complex, and hybrid. All you need to do is modify the oligosaccharide chains. But as Dr. Panini has mentioned, high mannose. Pruning starts in the ER and completes in the Golgi, please, for high mannose. That's why high mannose and link glycoprotein, one more difference, are co-translation modification. What do you mean by co-translation modification, anyone? Co means modification starts where? Co means where does modification start? Co. ER finishes in the Golgi. Post means modifications are in the Golgi. But for high mannose and aniline glycoprotein, modification starts in the ER, completes in the Golgi. But if you want to make complex aniline glycoprotein, what will you add instead of mannose to the pentasaccharide core? After the pentasaccharide core? For complex sialic acid. That's all you need to do. So what is the difference? There is a difference. Yes, you need dolicol for aniline glycoprotein, and there is a co-translation modification. I will show you in Dr. Panini's slide. He has mentioned the differences, but this is for aniline glycoprotein. But then once they are synthesized, so where did you synthesize aniline glycoprotein? Especially all of them. Where did you synthesize? What was the purpose of sialic acid? I was telling you, let's go back quickly. Somebody is asking sialic acid. What I was telling you is that, give me a second. What I was telling you is that once you have protein rich in asparagine, are you seeing my slide? And pentasaccharide core, all you need to do is add additional chains to form different aniline glycoprotein. So if you want to form a complex aniline glycoprotein, what chains will you add, Amir? If you want to form a complex aniline glycoprotein, will you add mannose or sialic acid? Will you add mannose or sialic acid? Sialic acid. That's all I'm trying to bring to your attention. It's not very difficult. If you know are the different oligosaccharide sugars, you will know how to form different N-link glycoprotein. Does that make sense? So let's go further. Give me a second. But once they are, where are you forming these N-link glycoprotein? Tell me. Every one of them. Where are you forming these N-link glycoprotein? Finally. Where are they formed? Where are all the aniline glycoprotein formed? In the Golgi. And did I tell you high mannose are lysosomal enzymes? Are high mannose example of lysosomal enzymes? Are high mannose N-linked glycoprotein example of lysosomal enzyme? Absolutely. So they are formed in the Golgi, but they have to be tagged. They have to be tagged by phosphate, which is done by which enzyme? Which enzyme adds the phosphate to mannose of lysosomal enzyme? Which enzyme adds phosphate to the high mannose aniline glycoprotein, which are lysosomal enzyme? Give me the enzyme that adds phosphate. Phosphotransferase. If phosphotransferase is missing, no phosphate will be added to lysosomal enzyme. They will not be recognized by mannose 6 phosphate receptor to eye cell disease. Eye cell disease has nothing to do with synthesis of aniline glycoprotein. Eye cell disease is the failure to add phosphate to high mannose lysosomal enzymes. So that's why they cannot go to the lysosomes. So tell me, what would be the cardinal findings of eye cell disease then? Because there's no phosphorylation, there's no tagging, lysosomal enzymes are not going to the lysosomes. So what would be the key finding of eye cell disease? Empty lysosomes and lysosomal enzymes in the plasma of the patient causing coarse facial feature. Absolutely. So high mannose are synthesized in the Golgi, but they have to be phosphorylated in the Golgi to be recognized by mannose 6 phosphate receptors in the Golgi. If they are not phosphorylated, they will not be recognized and they will not go to lysosome. Please, eye cell disease is a lysosomal targeting defect. Where are they formed? Aniline glycoprotein, Golgi. Which one is lysosomal enzyme? Which one is which aniline glycoprotein is example of lysosomal enzyme? Which aniline glycoprotein is an example of lysosomal enzyme? Anyone? High mannose. So is this aniline glycoprotein? Tell me. How do you say this is aniline glycoprotein? Give me one clue. How do you say asparagine? And why it's high mannose type? Because you see mannose residues. Yes, which is lysosomal enzyme. If you don't add a phosphate in the Golgi by phosphotransferase, they will be not recognized by mannose 6 phosphate receptors. They will not be targeted to lysosomes. Please know that in eye cell disease, there's nothing wrong with mannose 6 phosphate receptors. They are absolutely fine. What is wrong is which enzyme you see on the left? Sorry, what is missing? The ability to add phosphate to mannose residue is missing, not mannose 6 phosphate receptors. So that is eye cell disease, coarse facial features, lysosomal enzymes everywhere. And that is diagnostic of eye cell disease. Now let me go through Dr. Panini's question slides lecture quickly. So in other words, types are done in ER. In other words, yes, aniline glycoprotein modification starts, especially high mannose, starts in the ER and completes in the Golgi, not O-linked. Yes, let me show Dr. Panini's slide. This is all for the recap today. I will take your question, but I really want to, because students are stressing for that. I want to tell you quickly that you don't need to stress. Everything that I have talked here are in his slides, right? Let's take a quick look at his slides. Then I will open question. Give me just 5 minutes. I'll just skim through his slides and tell you exactly. Are you seeing Dr. Panini's slides, please, everyone? Are you seeing his slides? Everyone, good? Yes, now look at this. He has done it in a more detailed way, but don't lose the focus that I have given, please. Otherwise, you will be lost. I don't want you to get lost. I want you all to get good grades. You all are doing great. In biochemistry and genetics, I want this to continue. He has, first of all, introduced the word glycoconjugates. Please stick to your learning objective. He has, look at this. Let me get my pointer laser so I can quickly tell you. He has introduced the word glycoconjugates, which is the same I told you, carbohydrate associated with a non-carbohydrate compound. Someone has something in the chat. Everybody is good. Then he has asked you to differentiate glycoprotein from proteoglycan. Which glycoconjugates we have learned? Don't get overwhelmed with this diagram. You have learned proteoglycan, you have learned glycoprotein, and glycolipids are not now, but they have same function as glycoprotein. Where did you learn GAGs? Proteoglycan or glycoprotein? Where did you learn GAGs? Proteoglycan or glycoprotein? Proteoglycan, exactly. That's what he is trying to tell you. Great. Don't get overwhelmed with this. Also, tell me, where will you see glucuronic acid, hydronic acid? Where will you see glucuronic acid, hydronic acid? Proteoglycan or glycoprotein? Glucuronic acid, proteoglycan. I will tell you this one though. Fucose is seen in blood groups. Fucose sugar is seen in blood group. Also, have you seen xylose? Have you seen xylose in proteoglycan or glycoprotein? Xylose. Xylose. Xylose was proteoglycan or glycoprotein? Xylose. Anyone remembers? Proteoglycan. So you're just recognizing them. Please don't break. Sialic acid. Tell me sialic acid. Give me example. Where did you see sialic acid? Sialic acid. Sialic acid. Both in O-linked as mucin and linked as complex. Mucin and complex. Both have sialic acid. So where did you see them? Don't draw the structure. Don't get overwhelmed. I have explained you, right? Let's go further. A cell surface function, distinguished function. Cell surface is glycoprotein. Extracellular matrix is proteoglycan. Did we talk about this at the bottom? Lysosomal targeting. Did we talk about lysosomal targeting? Adding phosphate to mannose residues? Absolutely, that's in his slide. I'm just bringing your attention. So he has asked you to know, compare and contrast O and N-linked glycoprotein. I explained you very well. Where will you see asparagine? Where will you see asparagine? O or N-linked? Where would you see asparagine? O or N-linked? N-linked. N-linked is asparagine. Where do you see mannose? Mannose. Where do you see mannose? Mannose residues. N-linked. Which N-linked? Which N-linked do you see mannose residues? Which N-link do you see mannose residues? High mannose. Are high mannose type of lysosomal enzyme? Are high mannose lysosomal enzymes? Yes, absolutely. That's what he has distinguished. Please now, the next slide. Students are confused between UDP is just a carrier when you synthesize them. Please don't waste your time in doing synthesis or degradation. I've explained you the structure. They are synthesized in the same manner and degraded sequentially in the same manner. Now, some students are confused with, if I'm saying serine, am I talking about O or N linked? Serine, serine threonine. O linked, right? They're just telling you asparagine, asparagine, O or N linked. Asparagine N-linked. Please, some students are confused this when they are saying N-linked, why they have serine and threonine. This is just showing that they may coexist, but N will always be asparagine, and a few units later there could be O-linked. But that doesn't mean N-linked have serine threonine. They both here is shown as sequentially near each other. So don't be confused. I'm just also bringing in what complaints students have when they are confused. Please don't be lost in it. You need dolicol for N-linked glycoprotein. There will be a pentasaccharide core. Mannose trimming will start in the ER, complete in the Golgi. First few steps are CDG1. Last steps are CDG2. Secondly, O-linked glycoprotein, O-linked glycoprotein is post-translation, N-linked glycoprotein is Co-translation, please know that. There is no dolicol in O-link glycoprotein synthesis. That is why for N-link glycoprotein, especially high mannose, trimming starts in the ER, completes in the Golgi. Does that make sense? When you differentiate O versus N-linked glycoprotein, where would you see co-translation? N-linked or O-linked? Co-translation. N-linked, right? So please differentiate, definitely differentiate, compare, contrast. This is a part of your learning objectives. And don't be confused between N-linked and O-linked coexisting, but N-link is always asparagine, O-link is always N-linked, you will see asparagine, O-link, you will see serine or threonine. Now look at this without seeing the answer. He's saying mannose residues, okay? Mannose residues. So what are you thinking when you see mannose residues? Are you thinking O-linked or N-linked? N-linked. And when you think N-linked, is it asparagine or serine threonine? So see, what is your answer then? Your answer is C. And remember, N-link, especially high mannose, where does the pruning starts? ER or Golgi? Where does the pruning starts? ER completes in the Golgi. What is that known as? Co-translation modification. So you should do the differentiation. Blood group R, glycoprotein, glycolipid. He has explained the compatibility. That's not difficult. AB means no antibody. O means no antigen. O is universal donor. AB is universal recipient. Nothing fancy about that, but very important for your patient's life, right? Glycoprotein, proteoglycan, I have told you differences. Where do you see GAGs? Where do you see GAGs? Proteoglycan or glycoprotein? GAGs are proteoglycan. Oligosaccharide is glycoprotein. Oligosaccharide may be negatively charged. GAGs are always negatively charged. He has shown tissue distribution. Remember I told you repeating unit of acidic and amino sugar. What is this a structure of? Where will you see repeating unit of acidic and amino sugar? Proteoglycan or glycoprotein? Acidic and amino sugar. Where will you see acidic and amino sugar repeats? Proteoglycan. What is this known as? Repeating unit of acidic and amino sugar is also known as? What is it part of? GAGs. What is the older terminology of GAGs? What's the older mucopolysaccharide? And you have mucopolysaccharidosis. This is exactly, see, he has written acidic amino sugar GAGs. So it's not different. If you look at my slides, do not memorize structure, don't waste your time, but know where these GAGs are physiologically and clinically. Yes, you got to know. I told you I'm not seeing the chats right now. I'll just finish this. I told you the brush border, monomer, polymer, right? Xylose, galactose, O-link. When I'm saying all that terms, O-link, xylose, galactose, what am I talking? Proteoglycan or glycoprotein? O-link, xylose, galactose. Am I talking proteoglycans or glycoprotein? O-linked proteoglycan. You just got to distinguish, compare, contrast. Don't waste your time otherwise, please. Shock absorbent proteoglycans or glycoprotein? Shock absorbent. Shock absorbent. Proteoglycans or proteoglycan? Which one? Which gag you remember is a shock absorbent? Can you name one gag? Any gag which is shock absorbent. Anyone? Anyone wants to name that? Hyaluronic acid. So know your GAGs then, which are part of a proteoglycan. What is their function? And where are they important physiologically and clinically? Now look at this. You don't look at the answer. Now they are saying oligosaccharide. Are they talking proteoglycan or glycoprotein? Oligosaccharide. First of all, oligosaccharide is proteoglycan or glycoprotein? Oligosaccharide. When you say oligosaccharide chain, are you thinking proteoglycan or glycoprotein? Yes. First of all, they are asking you glycoprotein. And serine threonine, is it O-linked or N-linked? Is it O-linked or N-linked when serine threonine? It is O-linked. So definitely they are talking about O-linked glycoprotein. And what have they said? Let me uh where I was lost. Where I was lost. My God, I have so many windows open. So they are talking about serine and threonine and oligosaccharide. That means they are talking about. So what should be your answer? What should be your answer? Only glycoprotein, right? B, exactly, because they are talking about oligosaccharide chains and they are talking about O-linked. Remember the example I told you, mucin, collagen, and intranuclear protein. Yes, so if they are saying serine, threonine, oligosaccharide chain, they are talking about O-linked glycoprotein. I think this is one of the exceptions. Although when you say glycoprotein, what is more? Proteoglycan, carb is more. In glycoprotein, what is more? Protein is more. Exactly. So, what are mucopolysaccharidosis? Hurlers versus Hunter. What is the problem? They can't be degraded within lysosomes. Dr. Panini has also explained other mucopolysaccharidosis. They are only differentiated on the types of GAGs accumulating. What are the GAGs accumulating in Hurlers and Hunters? What are the GAGs accumulating in hurlers and hunters? All others are just differentiated from the types of GAGs accumulating. What are the types of GAGs in hurlers and hunter? They are, anyone? Heparin and dermatan sulfate. Then you distinguish heparin and dermatan sulfate, but they are single enzyme deficiency disorder. Hunters have a good eye. They hunt for an X. They are X-linked. Who has a successful replacement therapy? Hurlers or hunters? I think they also have you have a CV2 on hurlers. There's Hurler syndrome, successful enzyme replacement therapy. Eye cell disease is a lysosomal targeting defect, which Dr. Panini has explained. I have brought in different slides. Look at this. It's not a single enzyme deficiency disorder. Eye cell disease, multiple enzymes, lysosomal enzymes are involved. That's why you see a lot of debris, more than single substrate, and that is known as inclusion bodies. That's why it's known as eye cell disease. Coarse facial feature, milky cornea. What are you thinking? Coarse facial features, milky cornea, dermatoheparin, Hurler syndrome. So, see, everything is the same. Lastly, he has explained penicillin and vancomycin because they act on the peptidoglycan wall of gram of the bacteria. Please know that both can act on gram positive. Penicillin as well as vancomycin can act on gram positive, but they have different function. So which one forms D-ELA-ELA crosslinks? Vancomycin. Which uses penicillin binding protein? Penicillin. So main takeout is both penicillin and vancomycin gram positive, but different action. But gram negative, vancomycin cannot act. Only penicillin acts on gram negative. Why? Because gram negative have this outer membrane. That's all for today. If you have any question, let me know. I hope this helped. Great. If you have any question, and hope you all do well. We'll review next week. Take care. Bye-bye. If you have any questions,